Engaging with various different people can be tricky. In this episode, Andy and I are going to talk about community engagement as part of our series when it comes to engagement with practices, networks, wider systems, and various other parts, and help you understand how you might tackle this, particularly as a PCN network. Let's tech enhance your primary care and learning. Hey GP learners, and welcome to this new style episode that we've got with myself and Andy, as we're actually live in person for the first time in almost 2 years. Wow, it's a bit weird, isn't it, Andy?
Yeah, it's really nice to be face to face with you again, Gandhi. We're actually getting ready to go to the RCGP conference, aren't we? As we speak, we've been testing out various pieces of equipment and thought that we'd record this episode face to face and give it a go.
Yeah. And in this episode, we're talking about engaging with your local community partners. So this is the second in our 4-part series looking at engagement, as particularly a primary care network or practice. And feel free to check out our earlier episode that looked at system-wide engagement. But in this one, we're focusing on community partners. We're going to go into a little bit more detail as to what that means and how you can do that. And to help us, we've got some diagrams and flowcharts and stuff to help us, haven't we, Andy?
Yeah, let's talk about some frameworks. So if we just bring those up on the screen now, we'll be able to have a look. So in the first part, when we're looking at systems engagement, we use the Stakeholder Matrix. So and we've left the stakeholders that we identified from the wider NHS system there, and we'll place the other ones in and around and over the top of them, probably because we're going to end up with a lot of boxes by the end. So this matrix just helps people conceptualize and think about the different stakeholders that they've got. So on the bottom, there's an axis that is labeled interest of stakeholders. Stakeholders can have a high degree of interest in what's happening with your organization, your primary care network, or a low degree. And this axis up here, which is partially obscured by boxes, is about the power and the influence of the stakeholder. So this is the power or influence they have to make your mission a success or not. And you can place stakeholders in 4 quadrants. So if people have high power, high interest, then they are key players and you need to engage them very closely and think carefully about how you engage them. If they have high interest but low power, then they need to be kept informed. You need to show consideration for them. If they are low power, low interest, then they're less important, and maybe you can spend less effort and energy engaging these people. And if they're high power and low interest, then they're very important, but they're not really keeping an eye on what you're doing. So you need to meet their needs and keep them satisfied. And also, something that we were looking at in the last episode, you might find that some of your stakeholders are sort of down here, not interested, or maybe more up here, like NHS England, not interested particularly in your specific primary care network, but are really, really powerful. And you might want to think about how you can move people from one position on this graph to another through engagement strategies. So that's that diagram.
And as we said, we're going to be talking and focusing on community partners for this particular episode. So throughout this episode, we're going to switch back and forth to myself and Andy so you can hear us when we're talking, and then also have a look at the diagram. We're going to try and make this as big as possible so it's easy to see. So let's get started with our first community partner, shall we, Andy?
Yeah, so the first one that we've identified was patients. So we're going to be doing a separate episode on patient engagement, but they are a massively important part of the community, so we didn't want to ignore them here. Where should we place them, Gandhi?
So I think patients are definitely people we want to engage in quite detail, and they have a massive influence in the service we're trying to deliver. Although engagement with them outside of their direct healthcare can be a clear challenge for many places, but I think, they are high importance, high engagement. For me, how to do it is a bit trickier though.
Yeah, see, I think as individuals, they've got quite low power, I think. As a group, they've got really high power because we really need to be engaging with, listening to, and meeting their needs. And they probably start off in a place of low interest. So here, and we want to really be thinking about how we move them up over here. I'm going to put them bang in the middle for the purpose of today, and we'll deal with them at a later episode.
Yeah, and we will be going into more details into different types of groups of patients, although some of them we are going to sort of cover in this episode, and we'll get to them imminently.
Gandhi, before we deal with some of the other stakeholders, I just want to introduce sort of 2 other concepts that I think will be, or 2 other tools that we've used to think about engagement with the community partners that I think might be helpful. So the first is this diagram, which a lot of you will have seen already, and we've grabbed this from the House of Commons website, so just giving them credit for that there in the bottom right hand corner. Really, really helpful diagram. I've seen a lot of it around and used it in some presentations. So this is thinking about the wider determinants of health. So we know that Actually, only 20% of somebody's health outcome is determined by the healthcare services that they have access to, and actually 80% is determined by these wider general socioeconomic determinants of health. And we use this to brainstorm who the community partners were that we were thinking about today. So you can think about where people get their food from. So that's probably supermarkets really, for us, or takeaway places, all sorts of places. But that's places where you might be able to have contact with patients. You might be able to influence the behaviours of those organisations and the patients through them. Educational organisations are also really important. So engaging with the schools, perhaps universities, if you have them within your primary care network, and other educational organisations. And not just child education, there are adult education organisations as well. There might be employers. So think about the work environment. There might be employers who employ your patients, and you could do some employment schemes at work, or there might be just a case of actually just increasing access to employment. Might be something that's really, really important, or the quality of those jobs.
And I think it's also worth thinking about the various different types of employment groups you might be considering. So, worth noting that, if you live, for example, and work near a military base, you may have a lot of military personnel that have different access and needs to healthcare. Similarly, prison services may be something that you have to be aware of. Other kind of groups. Even if you've got big, huge employment communities, if you happen to live near one of the big factories and that kind of stuff, how people approach you may be slightly different because of those local employment aspects and things. It's clearly going to be different if you live in a local community with a really small employers compared to, working next to the big Amazon warehouse factories that employs most of the people in the area.
Yeah. So just moving through the rest of these, so living and working conditions. So if there's a big issue with employment, it might be worth thinking about who the landlords are, who are the people controlling those places where people live and people work, and engage with them. Unemployment has come up here as a factor. So it's not just about the employed environment, but what is happening to those unemployed people? Are you engaging with the job centre? There might be all sorts of ways that it makes sense to link up with the job centre to promote health to groups of people that might be otherwise difficult to reach. A lot of people have to engage with the job centre, even if they engage with nobody else, because that's where they get some of their funding from. Water sanitation is always included here. Hopefully in this country, it's something we don't need to worry too much about. Healthcare services obviously are here as well. So, general practice doesn't provide all of the healthcare services. There are community nursing services, there are dentists, there are chiropractors, there are private physios, all sorts of other people. And then housing as well, just down here on its own. This made me think about, say, the local housing charity framework in our area, that helps move people into housing if they don't have access to that housing. So that's a useful framework. And then finally, framework today. Just to think about, actually, once we identify who these community stakeholders are, it's important to just think about what do we actually want to communicate with them? How do we want to engage? What's the purpose? So it's often helpful to think about this: who, why, what, where, when, and who. Again, matrix. So who, who is it? Who's this organization or group that you want to engage with? Why do you want to engage with them? What's the message? What's the purpose of engaging with them? I think it's important to be clear and targeted and strategic about that. And then what's the sort of content? What's the type of communication that you want to do? Is it videos? Do you want a face-to-face discussion with them, for example? And then think about where, and that really means, you sometimes think about where are they? Do you want to go out to them and see them face-to-face? Or, are you aware that all of these people are on Twitter, or they're all on Facebook, or they're young people who use TikTok? Where are you going to connect with them? When? How often? Is this going to be a quarterly newsletter that you communicate with a variety of different organizations with, or is it going to be more frequent or less frequent? And then finally, the last who is who is going to do this, because clinical directors don't be doing all of this, Gandhi. Who else can do some of this work?
Absolutely. And it's key to remember that this is potentially where a lot of the ARRS roles can really excel themselves in terms of helping and supporting us in terms of how we're trying to do a lot of this communication aspects, because that's where some of this stuff lies. So social link prescribers, for example, can definitely help out with the housing and the finance side of things, potentially, health and wellbeing coach in terms of dietary stuff, food, exercise engagement, all that kind of stuff. There is a definite role for the ARRS roles in supporting a lot of this stuff. But let's get back to the original matrix and figure out where we're going to put all these people, because we want to make sure we're keeping this sensible and clear for everybody. So let's have a little look at it, shall we, Andy?
Yeah, I think some of these we can kind of group together. So I think as we do this, it'll become apparent that some things naturally sit together.
Yep.
So we can go ahead and do that. And it might be useful to share like what we've been doing to engage with some of these groups as well as we go along. MPs and councillors have come up next. So have you had much contact with your MPs and councillors? What have you been?
So I think this is something we started to do before COVID hit, but COVID kind of paused a lot of it, particularly with our local councillors, and recognising the fact that, you know, there are definite challenges for general practice, primary care services, and how that interfaces with the population. More recently, I've been contacting our local MP from where I work and stuff to kind of share some of the challenges we're facing and how can we actually work better with our patients or citizens, as they like to call them, to make things flow so much better. And what can we do locally to try and tackle some of the bigger challenges that we are now facing, in particular with health inequalities being a massive thing that's been shown for everything, to be honest. So I think this is an area where more networks and stuff should start to focus some of their attention, because actually that combined plan, particularly with the whole new ICS format that we're looking at, is definitely going to be important. What do you think, Andy?
So I think so. I've positioned this group. We dealt with this a little bit last time. So I've positioned them as having reasonably amount of power if engaged, but potentially having low interest. I think so. We've started to do quite a lot of community engagement in my primary care network at the moment, and what I've found is actually batching a lot of these together in a kind of bigger community engagement project can be really, really helpful, because these people often have a need or a want to engage with each other as well.
True.
So what we've done is create what we've called Bulwell and Top Valley Health Forum, and we've invited actually most of these community stakeholders along and listen to what they feel they need in terms of engaging with us and with one another. And actually we've created a quarterly meeting, Bulwell and Top Valley Health Forum, that is attended by all of these groups, including MPs and local councillors as well. And we're having structured discussions about the needs of the population, and that's informing what we do on population health management. But we're also finding they're actually really valuing that opportunity to talk to one another and just connect directly with one another, even separate from the CD and the health assets. You know, they're actually just making connections and making things happen. So it's really, really nice to see. How does this relate to the MPs and councillors? Well, they often have a need to be visibly doing things to promote health and well-being in their area. So actually, if you create a network effect, you know, we've all heard about network effects. You know, actually the value of something is increased by the number of people and partners that are engaged with it. So you can create a network effect, a center of gravity that actually helps pull in these people, and it's something worth engaging with, and it makes it easier, I think, to engage, particularly MPs and councillors, because they have a need to be seen to support these things. And if they can come to that engagement, that gets them engaged, and it also scratches their itch as well. So I always like to think about, when we think about stakeholder engagement, you know, what do they want and how can you create something that gives them part of what they want as well? So that's how you loop in and link in and entice in the MPs and councillors, I think.
And I agree. I think that forum method is something we're going to come back to a couple of times with some of these engagement parts. And is that the best way to try and, at the very least, start the engagement process? I think some of these discussions then come out from those kind of meetings and from those occasions to then have more impact, because often the meetings aren't where the decision's made. It's outside of the meetings, isn't it? But definitely the connections and, like you say, that network effect, I think, can be really effective for a lot of networks if they're to explore this. And I know that we're looking at trying to develop something similar to what you've done to try and meet those needs.
Yeah. And actually translating the energy of that group into something that is actually a tangible outcome or a project, that's the next challenging thing. So we're beginning to address that. We have some working groups now of partners that are more interested in specific themes around childhood immunisation, healthy lifestyles and mental health. And those working groups are where I think we're going to see some actual projects delivered. So we're working that through. Another question for you, Gandhi, because this is something I'm genuinely interested in your opinion on this. So it's a quarterly meeting. We're having working group meetings, but we're trying to do something to keep the energy of those meetings going, because they actually said, well, we'd like to communicate more often than quarterly. There was quite a lot of excitement from the group. I'm just interested to know how you might keep that alive in between, if you can think of anything. We've thought of something, but I'm not sure it's the right thing.
Okay, I think there's different ways. I mean, there's the option of sharing communications between each other. That can be a way of keeping everybody in the loop, shall we say. There's clearly the option of remote meetings to jump in. This kind of thing that you're describing sounds like the kind of thing that definitely works better face to face, having people in the room and that kind of stuff. But obviously, COVID rules and everything else, and how things move forward, maybe an interim remote aspect might help. And as I said, newsletters, that kind of stuff. I mean, anything else you were thinking of?
Yes, we're leaning towards newsletter and experimentation with a closed Facebook group.
Okay.
Because what a lot of them want is to they have two needs. So a lot of them, they need to promote themselves to other partners. You see, they actually say that's what they want to do.
Yeah.
And they need to see what other partners are doing. So we're experimenting with creating a place where actually they can throw some of their promotional material that can be picked up by other people. And it was a toss up really between another WhatsApp group or another Facebook group, and Facebook won. So, but we'll see how it goes. I'm a little bit of trepidation about that, but
I'd be thinking non-Facebook, non-WhatsApp with this kind of content, to be honest. But I think the group element, that kind of live asynchronous method of communication, absolutely. Personally, I'd probably go for something like a Discord server, to be honest. A bit more, you got the functionality of Facebook group with the security of it not being on Facebook. That's my personal view. But
it's another platform, Gandhi.
It's another
to
platform.
Get people engaged with. I think that'd be a barrier.
Yeah, I can understand that though, and it's that network effect. Go to where people are.
I thought WhatsApp might have been the way to go, but Facebook's won out for the moment.
Fair enough.
So let's move through some more of these.
Absolutely.
These people, but we might have hit upon a really good way of engaging with lots of them all together. I mean, utilizing network effects. Library and community spaces.
I think there's definitely an element of wanting to engage in, and that's potentially where you can access some of the community spaces, because as we know, estates is a massive challenge for general practice, and having other resources that you can use for particularly the physical space, as well as the resource itself of the library. It's information resources, and actually for a lot of patients, particularly in areas of high deprivation, may not have access to those essential things that many of us now take for granted, like broadband, for example. If you don't have access to the internet, you can't do a lot of the stuff we're asking people to do nowadays, and almost everything is now online. So, that's where libraries can be really effective for people. But even something as simple as having the time to go and read a book can be really satisfying and healthy. So, yeah.
I think what you're highlighting is some of these people, they are sometimes destinations that we might want to signpost people to and link in. I think libraries and community spaces, that's something that we've tasked our social prescribers to make those connections on behalf of the primary care network, as well as pulling them into the forum. I think a lot of these are similar and lumped together in this, perhaps starting from a low place of interest, but actually having some power in delivering the local agenda for primary care networks. I'm going to pop local businesses there as well. And anything additional, local businesses and large employers were not part of the health forum, Gandhi.
No.
Have you got any specific thoughts about engaging them?
I think this is somewhere where potentially there's the opportunity to develop relationships, because actually a lot of local businesses in particular will always want to see the local community thrive. And I think, if you're looking at can you help people have healthier lives, we're talking about supermarkets, greengrocers, meat producers, all those kind of things, helping to promote how they work and engage with their local community. Well, actually, if there are things that they can offer at the very least signpost to, and again, that's information through the health and wellbeing coaches, information to social link workers, information through the practice to other areas of services, I think that's a really positive step. Now, I know that there'll be some people concerned about, well, I'm promoting another business. Should I be doing that? Could you do that? Actually, I think you could. And let's even be honest, it may even be an additional revenue stream for some practices networks to consider, because if there's a mutually beneficial relationship that develops out of that, and that provides more resources for more services, hey, why not? Obviously, there are NHS business rules that you need to be aware of and stuff, so just to be mindful of that.
I agree with what you're saying, Andy. I'm going to drop some of these are quite similar. So I think charities, let's just pop them. Similar area to, I think, the others that we're describing today as well. Just notice we put Framework in brackets there. So Framework is a really active local housing charity that works closely with the local councils. So I think this just highlights it's important to kind of scope out who you need to engage with and who you need to be around the table. And that's where this local intel is helpful.
And I think that's just a case of focusing on the actual charities relevant to your local population, because obviously there are loads of different groups that would be really sensible and helpful to promote and engage with. but particularly for your local area, there may be ones that really do shine out. So if you work, for example, in an area of significant proportions of elderly patients, working with Age Concern, all those kind of charities to tackle some of those more specific local needs may actually provide benefits. So particularly dementia outreach nurses, I know definitely one, the Admiral nurses kind of concept and stuff, and that's something some networks have looked at. If you work in an area where there's significant issues with and challenges with helping asylum seekers, refugees, that kind of stuff, looking at the charities that specifically focus on those portions in the community, actually those closer links may help to strive the better health of our local populations and stuff. So targeting those populations and those charities. So like you say, framework for us in a city area, housing is a massive issue, homelessness is a massive issue. Targeting a charity that can engage well and potentially develop new resources and services to help your local populations. Yay! Definitely.
Good. I'm going to place religious organizations next. So, and I think these are all grouped in a very similar position on this matrix. I know they've been quite important in some areas around COVID vaccination efforts, for example, to reach certain groups. It's not been such an issue in my area, but have you done anything locally?
So locally, actually, so as part of one of the local CCG projects, I've been working with Kemet Radio to advocate for some of the challenges that particularly the Afro-Caribbean population, which is a massive listener group for that station, have had in terms of understanding, like you say, COVID vaccinations and shouldn't they, answering those questions and that kind of stuff. And actually, that's a significant proportion of my local practice community. So, we knew that we had low uptake of the vaccine for those communities, because a lot of them had uncertainties about should they, shouldn't they. And the only way to tackle that is to myth bust or false information that's out there and give them the opportunity to ask and answer those questions. And that engagement really has been quite fruitful. Similarly, there's been some of the local mosques and the local churches that we've engaged with. We've even had vaccinations delivered from those institutions themselves, because actually that's how you can have stronger and closer links with the community to help serve those populations.
Wow, that's really, really inspiring to hear. And I've been on Kemet as well a long time ago. They're really, really open to having visitors in and talking to them. I've really enjoyed working with Kemet in the past. Cool.
So who's next?
I'm going to pick a big one. So health visitors, midwives, district nurses, because I think these might need a separate strategy potentially to engage with effectively. And I'm going to put them high power and interest at the lower end potentially, but I think these could be really, really key partners for primary care networks. That's obvious. Are you doing anything specific at the moment?
Probably not. I think this is probably an area that we sometimes take for granted in general practice, because we have a lot of contact time, potentially with the people that are doing the job, but actually with those that coordinate how those jobs are done, how much contact and engagement do we have? Maybe that's something we need to consider. So I guess for us, it would be City Care, which we've started those discussions. Should we have started them earlier? Yeah, probably in retrospect. But the capability and the capacity of those services massively impacts both general practice workload, but also patient experience and stuff, and understanding some of those things and having them work through a lot clearer would always be a benefit thing. And no matter what area you work with, how good your district nurse services are, how good your midwife services, how all those kind of things, school nurses, that kind of stuff, how much they engage with you can massively impact obviously the way and the routes that we can deliver healthcare to our local populations.
Yeah, and I think all of these types of health and nursing organizations, I think they've actually got a lot to say to one another, and a lot to say to general practice, outside of specific communications about specific patients, which is really what it's restricted to at the moment, because often as GPs we might complain to each other about some aspects of how the district nurse service, the midwife service, the health service, the school nursing service work, and there's obviously reasons why they don't always meet what we see as our needs as organizations. But we never seem to actually have effective conversations to resolve those things. And I think primary care networks are a great forum within which to bring the kind of service managers together and have those conversations. It's something I'm going to look into. I think that's really good. And that's just the beauty of doing this sort of scoping exercise, which you can all do in your own individual primary care networks, maybe using similar tools, because it sometimes throws up things that you should be doing, that you could be doing, that you haven't really thought of or attached significance to. district
Next up.
nurses, don't know why they've got their own box. Move those over there. So there's council services. I think we would say many similar things about council service to what we've just said about the community services in terms of conversations that could be had about how things function.
Yeah, agree.
I think.
And I think that this may be one of the ones where potentially a little bit more leadership engagement needs to happen, because actually it's not necessarily the individual council worker that is working on the reception desk and stuff that you need that engagement with. It is those higher up processes to, again, similar in some ways to how we talked about the councillors and the MPs, maybe to understand how those services are working, because otherwise you get the standard computer says no response, which actually it is the higher areas that you need to have that level of engagement with.
I also think that there might be in this involving the council services and also the wider health services an opportunity to make it easier to pull together useful MDTs to deal with specific difficult, at-risk, challenging patients. And we sometimes want to do this as a practice, very rarely actually, outside of the scope of safeguarding, kind of the other forums that are there. But sometimes we think a conversation needs to be had, also often involving police and fire, which I think I'll place alongside these on the graph. And actually, maybe if the primary care network can establish some of these routes of communication and dialogue and who to talk to within the organizations when there's an issue, we might make it easier for practices to pull together something when they need to around individual specific patients.
And I think this is a key area where networks may need to focus on, because actually if you consider it, the anticipatory care element of the DES that kicks off from April 2022 has a huge element of tackling those high need patients and the ones that probably we don't serve so well because of either the high needs or the complex needs and stuff. And actually we recognize that general practice alone cannot solve those issues. So wider engagement will likely need to happen.
Yeah. I'm just thinking, again, you put transport on the list, which didn't immediately spring to my mind. So what did you have to say about transport? So
I think transport links and how people access services has a massive implication in their general health needs. So I know, for example, in my local area, and we have two hospital bases. So we have the Queen's Hospital, NUH Hospital. When I talk to patients about, meeting their healthcare needs, pretty much always they will say, I want to go to City because it's the closest hospital, because they don't have to get 3 buses to get there and stuff. Whereas anything that requires them to go to Queen's, generally speaking, their engagement with that side of things is always considerably less, even though the A&E department is based at Queen's. So something as simple as how to get from A to B can be a real challenge for certain patients. And if that side of things is not managed, or access to their healthcare services, we have many patients where mobility is a key factor for them, and they probably could engage with wider services, but they just need that little extra help to do it. If not, then you have to deliver it in the home. And whilst that's definitely appropriate for many of our patients, it's much higher resource use. So actually, do you get better by investing a bit more in transport, making that more effective? Could you actually have a better output in terms of, healthcare delivery and cost savings in the longer term?
Yeah, and the other area where I think transport's important is, and this maybe is just kind of knowledge about transport and as a factor. So within the Federation in Nottingham provides a lot of the extended access service to the primary care networks in Nottingham. And there are conversations happening now about the location of different GP access, primary care access hubs or spokes, sorry, we would call them. There's a hub centrally in the city centre, and about where spokes should be. And a lot of the conversations around that actually talk about actually having knowledge and mapping where the public transport links are, because people need to get to the spokes, if you put them somewhere, and not everybody has access to a car. So transport is really important and needs to be on your matrix, I think. So we've just got a few left here, so let's start picking them off. Care homes. This is another group where a lot of the emphasis of the primary care network DES is on care homes. So you might need a specific approach to engaging with them. I'm going to put them as low interest, because the number of times I ring up and they claim not to have heard of me before, or the primary care network, if they've changed the manager or something. So lower interest, but quite high power, because it's an important area and you need their cooperation, particularly if you're realigning care homes.
And it's a population group that we need to make sure we're focusing on their healthcare needs. Let's be honest on that point.
Yeah, we've tried to pull. We have a care home working group meeting that's currently running once a month as we iron out the delivery of the services to care homes, and we invite care home managers to that group to have discussions about how the PCN is deploying the care home services alongside the care home leads and other professionals within the practice. They don't always come, I would say, but they are invited and they have a seat at that table. Community pharmacy, spoke about this last week about how we're engaging fairly well actually in terms of delivery of COVID booster vaccinations. There's a lot of content in the DES and in the IIF about engaging with community pharmacies, particularly around community pharmacy referral scheme, for example. So I think it's important to engage with them. And again, that's probably a separate working group or a separate conversation.
I think that's an area where particularly our network pharmacists can take a key lead in terms of engaging with them and understanding their needs as well as primary care's needs, and paralleling them as best as possible to try and basically have something that's functional. You know, clearly from my view, having better communication between general practice and pharmacy services, I think would save a lot of strife and challenges for many patients, as well as the practices and the pharmacies themselves. So that the closer that relationship actually is and less of them versus us, I think we would see a really better primary care service, to be honest.
Yeah, and thinking about who can engage with other services. So we charged our first contact physios with making the links with sports centres and other providers of physical activity services within the primary care network. So that was something we delegated to them, and they report in about that to our internal staff meeting. So let's go.
And that actually reminds me, when it comes to business services and that kind of stuff, which I think we're coming on to with dental and other health, isn't it? These may be areas where you can look to provide those additional role services. So I know locally in our area, we've gone to a private provider of physiotherapy services, approach them, can they actually help us in delivering that FCP service? And they've done so with aplomb, and it's something we're expanding, and it's working really well. It doesn't necessarily have to be established primary care services that are then providing those services for you. We're looking at, one of our local physio services for some of this stuff. We're looking at some of our local podiatry services, private ones, and working to deliver that combined element, because actually we need to find this workforce from somewhere. We don't want to be stealing it from all the other places, because then that leaves everybody else sort of struggling and stuff. So definitely an engagement part, I think.
Yeah. One thing I'm learning about placing some of these partners, particularly with community engagement, because often the engagement with these people are optional. When we did the system level engagement, we needed to be engaging with many of the partners that were on there. So actually where they were placed originally was quite important to us. I think with many of these, it's about, if we feel we share a joint mission with them, it's actually about how we increase their interest and increase the influence that they have on the outcome that we want, to enable us to place them in this top right hand quadrant. I think that's what I'm learning from this. And finally, schools. Yeah. So we're having a separate schools conversation. We've had 2 meetings with local schools in our area, and that's beginning to go really well, actually. And once you start talking to them, they are interested in things that I didn't think they would be interested in. So they were very interested in what they call parental health and their role in promoting and supporting parental health as well as with students. And that was something that was quite surprising to me, for example. Have you been engaging with schools much?
It's an area we probably haven't spent as much time with, but we're starting to, particularly with our health and wellbeing coaches. It's something we're looking at, how we can develop that. We know there are definite certain challenges when it comes to, particularly younger education aspects of things. So, childhood obesity, growing problem for many of us. And I think, some focus on how we can understand that. But it's important to remember that how people approach and use health services, they learn that behavior from the things around them, from parents, from schools and that kind of stuff. So having that on your agenda, whilst it may not be something that helps you imminently today, this is engagement work that potentially will help you in the future. And we kind of need to invest our time in the future and stuff, don't we? Absolutely.
Yeah. And some of the people that might be hard to reach have to pick their kids up from school and have to take their kids to school. So it might be one of the only places that you can have contact with them. A little tip around schools, actually, because we've been feeling our way through engagement through these 2 meetings. So one thing that we have done is we've done a poster competition for local schools to do a poster about health and well-being. And we've been quite strategic in terms of why we've done this and how we're doing it. So yes, there's the element of engaging children about healthcare issues, but wrapped around that is the real value of it. So myself and Mark are going to go into a school each where the winner is, and that's going to be about actually getting into the school. We're going to meet with the staff as well as present the prize to the students, and we're going to have a conversation with the staff about what challenges they're seeing in terms of children's physical and mental health, what assets they're available in terms of where they can refer people to and what they can access. They might be aware of things we're not aware of, and we've got an opportunity to share what we know about what assets they can refer to and so forth, and actually explore this idea of whether we're all speaking the same language around children's health needs, particularly around learning and educational and Asperger's type issues. We can start that conversation. So I'm really excited to kind of get into the schools and have access to the staff as well as the pupils. We're also talking about maybe doing some careers talks, as well, and not just GPs, but also maybe even the receptionists and other people who work in healthcare, because aspiration within schools, the schools have told us, is a big issue for them, and they actually have difficulty accessing, because of the sort of area where we are and the type of people that live in that area, when they're drawing on parents to give sort of career talks and so forth, they don't always have access to the full range of professions. So they're quite keen to get access to a nurse if they don't have access to one at the moment, or a GP. So a lot might come out of that engagement with schools, and it's something that I'm quite excited about.
So we've talked about the various different groups that we see you may want to engage in and participate with and develop and things. There's clearly, I think, some we may have missed,
undoubtedly.
And love to hear from yourselves. Who have we missed? So definitely leave that down in the comments down below. As we mentioned, this is the second in our 4-part series, and the other 2 that we're going to look at is going to be looking at patients and also within Intra PCN, so your practices, the PCN staff and that kind of stuff. And that one's probably going to have a bit more focus on tools and that kind of routes and methods and stuff. We have covered a little bit of that with obviously, the framework that we mentioned about the who, the what, the when, the how, and the who again. And important to think about using those communication routes as best that works for yourself as well as for those other individuals. So hopefully we found this a really useful content guide to try and give you that direction of ideas and where to look and stuff.
And how to think about it.
Absolutely. As always, if you've got any comments or questions, we'd love to hear them, as we mentioned, and especially if we have missed things. If not, if you have found this episode useful, leave us a like down below. And as always, EGP Learning is here to help save you and your patients time by taking hands to primary care and learning. And we will catch you in the next episode.